Hello, in this tutorial we will see how to produce a 3D cephalometric analysis. We have to click on this button, 3D Ceph, and we start a new layout in the right side of the screen. So, making click on cephalometric analysis, we have a list with different analyses we can use. We can use until 5 analyses in the same time. So normally what I recommend is use at least the ARNet 3D cephalometric analysis, and I can just click on the arrow to put in my list. And then normally I use the morphing to produce later during the standard planning the morphing 3D functionality. So I add this and just click on OK. This is my list of analysis, and I click just on trace with the pencil. I locate the new landmark, and I'm starting to locate again the points. So I just have to follow the software. For software will present to me the view that is recommended for the points in question. For example, in this case, the vision I can see from the 3D view, so I can trace directly from the 2D. So this is the vision. This is the anterior nasal spine or the posterior nasal spine, for example, for ear. This is the nation. I can also change this configuration. If, for example, I want to place the glabella in this view, I can also place the positioning of the patients in this view and just take the point and save this configuration for later. So this glabella, this the subnasal point, this the upper lip anterior, the B point I can trace directly from 2D, the pogonion also, menton, frontozygomatic suture. Here I can also activate with the A key this kind of cross, so you can see here exactly the point you are tracing in the 3D. For example, here you can see the suture, zygomatic arch, the angle for the mandible, the point of osteotomy right and left, the vertical, gonion right, gonion left, the body. Take a look, have a look. If I place one right point in the left side of the patients, the software say to me, please, this landmark should be in the other side. So I have to place correctly in the right and left side. I just take the point of the jaw in the second molar. This is the dental midline. The soft tissue lesion. Now the software also present to me different kind of transparency and opacity. So I can put this point over here, this over here. I can activate the A key to better cross this point. The nasal right and left. The cheekbone is the most prominent part of the cheek of my patients in 45-degree views. Now I have the cervical point, the soft tissue menton, soft tissue pogonion, lower lip anterior, pronasal, A soft tissue A, I can directly go from this side, the upper lip stomium, the cilium right, cilium left, the auxiliary of the chin here and here, the soft tissue gonion right and left, the trachea in the ear right and left, the throat almost here and left, and that's all the point placed. When I finish, I just click on close. So now I'm able to see quantitatively the value of all these points. In Ceph 3D analysis here on the right side, I have access to ARNet 3D or morphing analysis that I performed. So here with the plus symbol, I can open all this window. I can see, for example, the point for anterior nasal spine and all of them. So, for example, for the midline, I can also activate with the eye and it can suggest to me that there is a deviation of 0.7 millimeter of mandibular dental midline. I can also show any kind of points, line or planes, like the mid-face plane. I can show it. I can use different points like for the skin, for the bone, or all of them. I can show and aisle all. So I have different tools here in the CEF 3D analysis and points and planes to use according to my treatment plan.